Welcome to the Transforming Trauma podcast. Transforming Trauma is presented by the Complex Trauma Training Center. I'm your host, Emily Ruth, and I'm so glad you've joined us today. As a mental health professional, you care for others, and the Complex Trauma Training Center is committed to caring for you. We are thrilled to introduce our Space Program 2025, an inner development program of support and self-discovery for therapists on the personal, interpersonal, and transpersonal levels. Therapists often focus so much on learning skills to use with clients that we don't leave space for ourselves. This interactive experiential program offers an immersive learning environment designed to cultivate space for ourselves in our professional role. As Viktor Frankl taught, between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. Starting February through December 2025, we will host 6 online sessions designed to cultivate space for self-care and self-discovery. We will be exploring the obstacles that stand in your way of being the most present, heartful, and effective therapist possible. Together, we will explore in a safe, inclusive, and supportive environment with the intention to create greater effectiveness and resilience in our professional lives. Please visit complextraumatrainingcenter.com and secure your spot in the SPACE program. It's time to care for you. And now for our interview. Dr. Daniel Morehead, MD, is a psychiatrist who speaks nationally for mental health education. He is the author of Science Over Stigma, Education and Advocacy for Mental Health, and the director of Psychiatry Residency training at Tufts Medical Center in Boston, Massachusetts. Prior to this, he enjoyed a private practice in Austin, Texas for over 20 years. Dr. Morehead maintains interest in psychotherapy, brain science, and spirituality. Please enjoy my conversation with Dr. Daniel Morehead. Okay, I am sitting here with Dr. Daniel Morehead. Welcome to Transforming Trauma.
Thank you. Great to be here.
Yeah. So how we often start these conversations is really just a question of what would you like our listeners to walk away with from our conversation?
Yeah. So 2 things. One is more vague and one is specific. The vague one, but which is close to my heart, is a shared experience of the wondrous complexity of what each human being is individually and the joy of exploring and better understanding that. Many of us in the mental health field get asked by outsiders, how could you do this all day? I'd be so depressed listening to people's problems and trauma. And of course, we share the suffering, but at the same time, very inspired by talking to people about their experiences and pains and even traumas. Not that it's like, it was good that it happened. It wasn't good that it happened. But the wonder of how people survive and adapt and grow and heal is just so spectacularly beautiful that I have this hope that every conversation related to it will share in that quality. So that's a vague hope for the day. And then my specific one is within myself and hopefully anyone else who's interested to deepen this sense of we're all in the same boat, including we're all subject to illness and pain and limitation and the ups and downs of life, that we're all in this together. And there's no us people and those people, right? There's not this illusory separation of, well, I'm a mental health professional. And then on the other side, there's people who have struggles or illnesses as if I don't have them. More the sense that we're human beings and the human condition is that we all suffer and we are all subject to illness inevitably. And we know this, and if people are mental health professionals, it's their bread and butter. And yet I find myself every time there's a conversation or I'm doing a presentation, there are pockets within myself that it hasn't fully penetrated. And I haven't operationalized that perspective. And every time I do, I feel this relief of letting go of this thing of, well, I somehow have to be on the 100% healthy side or 100% right side. No, there is no side, and we're all in the same boat. So I guess that was pretty general too, but it's still one of my two hopes for today.
Oh, I really appreciate the way you articulated that. My heart just kind of opened. It's so aligned with how I'm kind of holding this work, and there's no us and them. It's we're all in this together. So thank you for that. So one of the topics, and you've written on many, I kind of went down a rabbit hole looking through a lot of your work, but one of the topics that has really stood out, and I know there's been a lot of questions in our community and in the mental health field in general, is around neurodiversity. And there's it feels like there's like two camps often. It's like this or that. They hold it this way or that way. And it can be kind of polarizing and maybe even harmful if we're looking at maybe two ends of the extreme spectrum. And so your voice really seems to be very balanced and grounded, and there's truth there in how you talk about it. And so I wondered if we could explore that territory a little bit this morning.
Beautiful. Yes. And feel free to interrupt.
Okay.
But I will hold forth on neurodiversity, I guess, saying first that, disappointing or not, I don't claim to be an expert in neurodiversity. I have an interest and long involvement in how we understand mental health and mental illness in the larger culture. So that's my thing that I talk about and write about. And then, of course, within that, neurodiversity is a very important and powerful idea that's come up. And like so many of our ideas that have to do with mental health, there's this weird tendency for things to be polarized. And maybe that's part of the age that we live in, this intense polarization. Regardless, I feel it within myself. And so I'm trying to balance within myself, because I'll notice, talking to someone or listening to someone or reading something, I'll have a reaction of, well, that's so ridiculous. How can you say that when we know blah, blah, blah? And then in another conversation, I'll have the opposite reaction, but of equal intensity. So with neurodiversity, to some degree, you could say it was born and developed in an environment of some polarization, and I think a very good attempt to rebalance things. And so to be more specific, the idea that neurodiversity is the idea that, yes, we all have very different perspectives. Our minds work in different ways. And in fact, there's a spectrum or array of diversity about how our nervous systems work that are very much a part of people being different and their minds being different. And so we can take that as just part of life, right? It's analogous to biodiversity. There's all kinds of differences, not only between animal groups and species, but even amongst the same species. And so there's this fecundity, there's this diversity, and actually it's part of life. It's part of evolution. And we as human beings are part of that too. And then the balance that I think this idea is trying to address is to say, okay, people that maybe aren't as typical or think differently or perceive differently or go about life differently from the dominant culture are not wrong by virtue of being different. They shouldn't be second-class citizens. They shouldn't be left out. They shouldn't be persecuted. They shouldn't necessarily even be pathologized. And so this idea began to be articulated in the 1990s. And as it's easy to imagine, it was on the heels of various social justice movements, especially in Western culture, with the civil rights movement and the intensity of that in the 50s and 60s, followed by feminism and gay pride. And then in the 70s and 80s, what they called at the time the disability rights movement. There was actually a lot of social protest, social justice activity on behalf of disability rights that culminated in 1990, at least in the US, with really big legal reforms. And the idea was, we don't want to be second-class citizens anymore, and we're going to stand up and speak up for that. And so people would literally get out of their wheelchairs and lie on the street and block the street. or go to the Capitol and get out of their wheelchairs. There's one famous thing called the Capitol Crawl, where people dragged themselves up the Capitol steps to put in our culture's face the idea that not having access is not okay. And so neurodiversity, I think, fits well within this, with the idea that not just in terms of physical functions, but in terms of mental functions, there's so much difference out there. And everybody should be welcomed and respected and treated with dignity. And we should see the positivity that people bring when they bring in something different. So great, makes sense. I've always identified as somebody a little bit different or on the edges of the group myself. I haven't identified as, say, autism spectrum or ADHD, but I feel that within myself. I feel like I work at the edges of culture in my work in mental health. So on one side, there's a huge step forward for me with neurodiversity, and the other side is that I'm a psychiatrist, and so I deal with what I think of as mental illness all day. Now, I don't just deal with illness, right? I deal with growth. I deal with, problems that we wouldn't consider to be illnesses. But a lot of my bread and butter is somebody's going along in their quote unquote normal state, and then they get depressed and things are not the same. It's not the normal me if I'm depressed, which I actually have been depressed. So I know what that one feels like. I don't get up and do things in my normal way. I feel horrible pain and self-doubt, all kinds of things that are not the normal me. And I really want to get back to the normal me. So that's pretty straightforward. And people will often come in seeking therapy, or they'll go to their primary care doctor or the psychiatrist for things like that. So great. That is less tricky than the situation where people have what's called neurodevelopmental issues. And in that category are things like autism or autism spectrum and ADHD and dyslexia. And these are cases where people aren't like going along in their normal state and something basic changes. These are situations where somebody, as long as they can remember, this is the way things have been. So it's harder to say, well, what's just me and what's maybe some condition that I do or don't identify with. And then it gets very tricky to say, well, what is that? Is that neurodiversity? Is that also an illness, or does part of it have to do with a medical condition? We know medically that some people, for genetic and other reasons, do have lifelong problems that are medical conditions that are always a part of their lives, like cystic fibrosis is one, sickle cell anemia is another. So we do have that analogy from the more purely medical side, but we also have neurodiversity on the other side that reminds us, okay, people are drastically different, and we shouldn't automatically think, oh, that person's different, so they're ill. So then what do we do? Well, as a psychiatrist, I help train new psychiatrists. And what I tell them is we don't go seeing people on the street and tackling them and saying, you have to come in for diagnosis and treatment, and I'm diagnosing you as whatever, ADHD. We don't do that. People come to us. If they're adults, they self-identify that they may have an issue, and they seek out some kind of treatment, or maybe something else, maybe life coaching, or maybe a psychic, or maybe a healer in a different tradition, but they seek out some kind of healing, or they don't, and it's their choice. And then if they do come in, what we do is we have a conversation where I remind myself I know nothing about the person. And then after an hour, I'll usually say this to people I see, look, we've been meeting for an hour. I have to admit, I don't know you better than you know yourself, right? Nor will I ever.
I love the humility there.
Yeah.
Mm-hmm.
But here are some ideas, here are some thoughts. And they're based on what other people have told me with experience in this field, and they're based on different things people have written. But for each individual person, I feel we have to write our own book. Each person who comes in, I'm trying to help them write their book, but it's their book and they're writing it. Mm. And so together we explore, but that person ends up saying, okay, I think this fits for me and it's helpful, or this doesn't fit for me and it's not helpful. or this matches a lot, but you know what? I think it does more harm than good. I don't need to make use of this label. And so always, 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 I think we need to avoid our sometimes painful history in mental health of putting something alien on people. Because as psychiatrists, I also remind our trainees, the state has the power to compel people to get treatment, right? Like somebody's trying to kill themselves or somebody else, the state will step in and say, we're gonna force you to have treatment. And that comes with all kinds of baggage. But as healers, therapists, doctors, we actually don't have that power. And I'm so glad we don't have that power. And then just to continue my free associations here, the other issue that becomes very fraught is with kids, because kids very, very rarely say, hey, I'd love to get some therapy, or hey, I think I might need to see the psychiatrist. Kids tend to not want that kind of intrusion in their lives. And so often what happens is concerned family brings them in, or school may highlight an issue. And that is, as I like to say, that's reason number 258 why I'm not a child and adolescent psychiatrist. Not because it's not a beautiful thing, but just because it's so difficult to navigate that. And so some people as kids get help and they really flower and thrive. And I know many, many stories from adults where that happened. But some kids feel very scarred by being taken in when they didn't want to go in and given labels that feel very alien to them. So I guess that's a very long-winded way of saying, yes, I feel the delicacy of all this within myself, and I see why it's sensitive.
Yeah. Yeah. And I so appreciate that even just as you started talking about it, acknowledging kind of that there's sort of some inner conflict around how we hold this, that in one conversation, you might sort of lean in one direction, and another conversation, there's kind of an impulse to lean in the other direction. So acknowledging that feels really supportive in this conversation as we explore a little bit more. So thank you.
My pleasure. You can tell that's my way of dealing with polarization, is realizing that if I'm feeling extreme on one side, that means within myself, there's some other side I'm fighting against, or even having an argument in my head. I may be the only one who does this, but I suspect I'm not, right? I'm having an argument in my head about politics or something. And then I'm like, who am I arguing with? Who am I telling off here? Right? Some imagined person, but it's me. It's all in me.
I really resonate with that. Yeah. Yeah, for sure. So you said this piece around, I mean, when you talk to maybe adults who had, there were interventions of some kind when they were younger, can you speak to, like, I've heard folks say different things of, well, this is how I'm wired, or they might say, well, I had a lot of trauma and that's why my brain works this way. So there's so many different ways to hold it. And maybe I'm just revealing a bit about myself. So before we pressed record, I mentioned to you, there's definitely times in my life where I feel like my brain operates a little bit different. I meet the world in different ways. I remember as a teenager, it was like some cartoon, and I'm probably going to botch it. There's like a cartoon where it was like, if we measure, a fish's ability to climb a tree, like we've got it wrong. And that's kind of how I felt growing up, is like sitting in this desk for, however many hours a day a kid sits in a desk. I grew up out in the desert. I thrived like running around, climbing trees and that sort of thing. I did not do well sitting at a desk. Like academically, that was really, really tough for me. And it wasn't until I was older that I was like, oh, I think my brain just works different. And I hold it in a kind of way where I see it as like, yeah, but there's so many strengths to that, like the way that my brain works. And so I'm not pathologizing myself around it, but I know that a lot of folks, especially if they've sort of been given these labels at a young age, they can feel very pathologized. And so maybe if I were to narrow down the question is like, what do you see in terms of maybe the pros and cons? And I'm really hearing you say, as you meet the patient, you're checking in with them. Well, what is going to be useful for you?
Yeah. So to go back to your example about sitting at a desk all day as a kid, I think that's a great one. And I have myself puzzled over the ADHD, attention deficit diagnosis, my whole career. Because on one hand, although I don't identify in that particular way, growing up, I didn't want to be in school. And I still remember as a kid, I just felt like I was about to explode in the 2 or 3 or 4 hours till we got recess or lunch or school was going to be out. I remember watching the second hand on the clock and trying to focus and see if the big hand, if I could see it move and willing it to move to get to 3:21 when the bell would ring and I would be free. So then I think, and so people who have more trouble sitting in an uncomfortable desk under fluorescent lights doing tedious work that very few people find interesting for 6 hours a day, I think adults wouldn't really do well in this, much less kids. And yet on the end of that spectrum of not tolerating that, we call that ADHD. So what is that, right? And then before schools back in human history, well, these were the kids and the adults who were running around like exploring, discovering new things, finding a new watering hole, or here's a fruit bush or something. And it presumably it works pretty well. And we have this culture that has unbelievable demands to pay sustained attention to tedious things, this is a separate tirade, but that's one of my deals with technology is just more and more forms and data entry and surveys, and it's just never ending. So, on the other hand, have had a lot of joy in treating or working with people who come in. They want to be evaluated for attention deficit. They've read something. It sounds right to them. Somebody in their family or a loved one says, oh, this is you to a T. They've seen books like, You Mean I'm Not Lazy, Crazy, or Stupid, right? One of the great titles ever for ADHD, right? That you're none of the above. And it's liberating to begin to understand this is just my wiring. It's not bad. It's not a lack of effort. Doesn't mean I'm incompetent or stupid. And then that's an area where there are benefits from psychotherapy, but probably more than other problems, you can see dramatic responses to medication. And so I can think of people right now that I've seen that were on the verge of divorce that didn't want a divorce, or being fired from their job that didn't want to, or failing out of school. And a pill never solves all of somebody's problems. It doesn't totally solve any of the problems, but it helps symptoms enough that people come back and say, when I need to focus, when I need to sit down and get something done, I can do it. Versus I sat down to do it for the 10th time, and then 2 minutes later, I'm aware of, wait, I'm up and flipping on the TV, and I got to get back to whatever I had to finish. So the amount of relief for people is just palpable, and that doesn't prove ADHD is an illness, but it does prove that in our culture it can be a big issue. Okay, so then from there, for people like me who our own minds pester us about consistency, okay, do we call this an illness or not? Well, in one way it doesn't matter, right? And it's up to each individual. So perfect. In another way, to try to think it out, I feel like, well, there's, at least in the research we have so far, there's a spectrum. Like with attention, there's a spectrum. There are people way on the end of they can focus well, but don't ask them to be spontaneous. They're almost obsessive in their, I get locked in and I have to finish this. And I've had people who are late for every appointment because they had to finish something and they couldn't stop with it unfinished. And then you have the whole spectrum to the other end of somebody who says, I've never read more than one page of a book in my life because I try to read it for the 20th time and I've lost the train of thought before I get to the end of the page. So you have the spectrum of attention. And at some point, many people I know say, and I experience too, sitting in a room and talking, this is pretty out of control, even like to have a conversation. Not that it's unpleasant, but it jumps around so much that after 45 minutes of this kind of conversation, I can't remember where I am or what we were talking about or where we were going. There's a lot of interesting stuff, but it's all flying through the air and bouncing off each other. And that makes it very hard not only to have a satisfying and helpful interaction in a mental health professional's office, but also for this person to get almost anything done. And so I'm convinced that at the extreme end, that there is something wanting to settle down and pay attention and finish a task that I just can't do, even in the most basic way. Somehow my brain is not doing what I'm telling it to do. And because we have other information from head scans and other kinds of microscopic brain studies, that something's different there to the point of not working the way we would expect it and look for it to work, I would say, well, somewhere on the extreme end, we have something that you could call a disorder or an illness, which means the body is it's not linking up and functioning like it's quote unquote supposed to function for something basic like what? My mood or my ability to pay attention or my ability to have social interactions. And so with autism spectrum, they even renamed it a spectrum because it is. There's a whole spectrum of people, all the way from people like me that would identify as kind of nerdy and maybe a little bit socially awkward, all the way to people who used to identify, and some still do, as like Asperger's, which is more mild symptoms, to more symptoms that are more on the pronounced end, where it's very, very difficult for somebody to have even basic social interactions like a basic conversation. And so at some point in my mind, there's a place where most people, not everyone, most people begin to say, okay, somehow the brain didn't wire up like we would normally expect. And we can see this across cultures, and we can at least imagine in whatever time of history, this would probably be a big issue or a big problem for functioning. And then we look into brain science and, oh yeah, there are very different things about this that are not working in the ways that we would usually look for them to work. And we see, animal models that reflect the same thing. And it's not that it's an airtight case or people are compelled to believe this, but to me, the evidence weighs on the side of at some point along the spectrum, we're getting into what we would call a disorder or an illness. And where that line is, I still don't know. It's not my expertise, but I think about it all the time. And what I really think is there is no line. It's this gray zone and it's the spectrum. And depending on where culture is and where the individual is, it's more or less of an issue or a problem. And again, if it's not a problem and somebody's good, great. Or if our society and culture can flex itself to help people better integrate and function with less stress, great, we should do that. But within the limitations that I know I have and our culture has, there's still a group of people who they and their families and other people who work with them identify that, okay, this is a disorder, and if I could change part of it, I would. Okay. Then what I can feel within myself is this tension rising, like, wow, if people are listening to this who really strongly identify as neurodivergent and say, don't put a label of pathology on me, am I going to offend them or alienate them in some way that I never want to? Here is my one, I think, possible point of difference with some people who articulate neurodivergence most strongly, so strongly as to say, okay, neurodiversity, great. You should not call any of it an illness or a disorder. It's not pathological. You're just doing that to exclude us. They used to think left-handers were pathological. They used to say if your skin was too brown, you're pathological or something's wrong with you. Don't say something's wrong with you. And what's wrong with that? Well, nothing, except in the sense of I feel that unwillingly there's some leftover residual stigma from our culture in that point of view. And by that, I mean the assumption that if I have an illness, then I'm less than, or I'm second class, or I'm not good enough as a person. Mm-hmm. And I will fight that tooth and nail, because getting sick, having a disorder, having an illness, having things wrong with you developmentally, all of which I've experienced, they're part of being human. And we're not less than. And to say I have an illness, which I personally do, I have several chronic illnesses, is not saying I'm less than. Now, yes, our culture used to do that. It used to be a stick that we or our culture would beat people with, saying something's wrong with you, so we're leaving you out or excluding you, or we won't let you do this job. And that is as wrong as the day is long. And I'm so glad that we're getting beyond those times. But part of getting beyond those times for me is saying, if I look at all the information and this looks to me like a disorder, there's nothing wrong or bad about that. I'm not less than because I have depression or anxiety or developmental trauma or autism or ADHD. And I feel passionately that I have the passionate hope that that's where we all want to go as a culture and as individuals. And then everybody's truly welcome, right? Like, I'll only be welcome if people say I don't have an illness. Well, what if I do have an illness? Which again, I personally do. I want us all to be welcome. And then on that social level, I'm just blowing steam here because nobody really, nobody asked me, I think about this with politics. I get all revved up over the Middle East or whatever. Nobody is waiting for Dr. Morehead to say, what should we do about the Middle East? Nor are they even waiting to say, what should we do about neurodiversity?
Well, I'm asking, so.
Okay, yeah, and thank you. You're very kind to ask. So I feel like there's a social level on which I'm 100% with neurodiversity about, we don't even need to ask, well, is this an illness? Do you have an illness? If somebody's like, if it's a social group or a job setting or whatever, people are people. Everybody gets respect and everybody gets the benefit of the doubt and everybody's welcome to contribute what they can contribute. And we don't need to be pathologizing each other. And I include myself in that. I'm a psychiatrist. If somebody's not coming to me professionally to talk about this, I don't need to be putting people in boxes in my own mind. We don't need that in society. The only place we need it is where people or family feel like, okay, we have a problem here that's intractable and we need some help. And that's a private thing. And I hope people do feel free to get help or to get consultation, like with mental health professionals and others. But on the social level, yeah, I truly agree. We don't even need to go there. I hope that made sense. I feel strongly about it, but I hope it made sense too.
It did. And I'm feeling sort of some things reorganizing inside of myself as you're talking about this. So forgive me if this comes out a little blurry, or you're bringing up some points that are helping me maybe shift how I'm relating to some of this. So there's a difference between pathologizing. Would you say it's a condition? Like if someone would identify as having ADHD or autism, there's a difference between just acknowledging it and saying, okay, there's some support that can be had if that's what you're seeking, if that's what you're wanting, if you're coming to me for some support around this. I'm not pathologizing it. I'm just acknowledging this is something where you're seeking support. There's a difference there. I'm hearing you name.
Yes. Yeah. Yes. And so this comes up a lot in public discussions with our friend and enemy, the DSM, the Diagnostic and Statistical Manual. That's the so-called Bible of psychiatry. That's really not the Bible at all. It's a book of codes. But with the idea that, and with some justification in the past, that psychiatry or mental health professionals were reclassifying people as having disorders or pathologies that really aren't, and we're making this up anyway because we can't prove that most of these things are disorders or illnesses. Again, I agree with that on a social level. We don't need to go putting strangers in boxes, to put it another way. And then when somebody comes in, it can happen that people feel roughly treated, like the doctor comes to their own conclusion in their head, or the therapist does and says, you have this, and this is the only way I'll work with you. I still feel that more often than not, knowing a lot of mental health professionals, even if we don't do it that well all the time, what we're trying to do is say, look, we've got this information. Or we've got this experience. Other people say X, Y, and Z about what they're going through in this regard. Other people who report attentional problems say this, and here's some books, and here's what the DSM says. But again, how somebody wants to use that and whether it's helpful, it's up to the person. And so what do we do in treatment? We meet people where they are. Sometimes I say, look, you're driving the car. The car is you. You're driving the car, and I'm a passenger. And you might kick me out anytime you want, anytime I'm not welcome. But if you want me to ride along and talk about where we're going and see if there's maps in the glove box, then great. I'm down for doing that with you. And that may seem idealized, and I'm sure I personally don't do it perfectly, but I really do feel like that's where most of us are coming from these days in our field. Not like I'm the expert, you know nothing, and so I'll tell you what to do. The most terrifying thing in my mind is that somebody would take me that way and literally have to do everything I tell them to do, which we know would be a disaster as mental health professionals.
Mm-hmm.
But they don't, people don't tend to do that, and I'm glad.
Yeah. Yeah. Gosh. And I'm just thinking about how I said that earlier, sort of reflection, that it seems like really obvious to be like, okay, we're not pathologizing if we're just acknowledging. But I mean, as I say that, I'm like, I do feel like that happens. Like, well, and maybe I'm thinking of specific situations, but to sort of like distill it down, there might be someone whose partner is saying these traits that you have, the way that you navigate the world, there's impact on me or on our family or on people that you work with or like whatever. We need to look at this. We need to address this. And so there's, all the stigma that can come with sort of labels. And when there's people, saying, I don't want to be put in a box, which you're naming, like we shouldn't be putting people in boxes. And how do we acknowledge some of these parts of the experience of maybe being neurodiverse? And also, can you sort of talk a little bit about neurodivergence and diversity? What's the difference there?
As far as I know, neurodiversity is the broad idea that people are very different in regard to their nervous systems, and that's natural. And neurodivergence is when a person experiences that they are neurologically atypical in some way. Like I seem to be really different in how I see things or think about things than a lot of people around me. So I think of them as pretty much the same term, and one is just applied to everything and the other is applied to individuals.
Okay. I was curious. There was like a lot of charge around that.
Right.
There was a conversation online that I was observing.
Right.
I was like, whoa, I had no idea this
there
was like a
thing. There are probably
thing.
debates that I don't know about, but there's enough controversy for me, so I don't need more.
Well, that's why I asked you, because again, I feel like you have a very balanced voice. So I just wanted to hear how you were holding that. So if we can sort of shift a little bit, there's sort of this intersection, and I named it a little bit earlier, and I've witnessed again, maybe conversations online. There's a lot of charge, it seems, around folks who have experienced trauma and folks who would identify as neurodivergent. And maybe there's like an intersection there. And I've heard people say, yeah, I got treatment for my trauma and I noticed some of the symptoms that I experienced in neurodivergence shifted or changed. And I've seen them be attacked. They're different. You're talking about different things, and don't bring that into the space. And I don't know. That's something interesting. And I don't know how you would hold that, or if that's something you've observed or witnessed. Curious.
I have to a degree. And like so many things in our field, I think it's just so multi-layered and complex. One aspect of it that I don't think you were asking about, but it crossed my mind in regard to this conversation, is the question, even with just trauma in itself, are our adaptations to trauma, are those adaptive and positive, or can there be pathology and breakdown because of being too traumatized? And that's another intellectually fascinating question, but also like existentially gripping for people who have to deal with this about, who am I and what's happened to me and what part of it do I carry that's me and what do I feel like isn't me that I either want to shed or minimize. And I've convinced myself over time that in terms of trauma, it's both. It's both an adaptation that allows people to survive. If you're hypervigilant, there's a good reason. And that reason may have been what you grew up with, but your adaptation to being hypervigilant allowed you to survive. And we can see that with almost every aspect of trauma reactions. And then at the same time, I realize I'm preaching to the choir here, there's a price to pay for being hypervigilant all the time. And my brain's saying, don't go to sleep at all because you'll be vulnerable. Or I've known people who couldn't sleep. So we said, well, should we try a medicine for sleep? Being sedated made them more anxious terrified and panicky because it felt like losing control. I'm not alert. I wouldn't be able to respond if something happened. And there's a price of if I'm hypervigilant all the time, it can be hard on my brain and my body. If I get very little sleep, there's wear and tear. So for me, there's aspects of both, and that's what we're trying to work with in treatment. And where do we go from here? Okay. So that answered a question you didn't ask, but then the overlap between people who experience neurodivergence and trauma, like everything else, we can have both, right? I wouldn't say this, but one person who sees me when I talk about, well, it can be both and, always says, yeah, my regular doctor told me you can have both ticks and fleas. And the person laughs.
Okay.
I don't bring that up with people, but I always think of that when the both and comes up. So I personally have ticks and fleas. And so, sure, neurodiversity is common. I mean, there have been estimates of, maybe 30% or more. I don't think we really know, depending on how we define it. But it's common. And so, of course, everybody's vulnerable to trauma worldwide. I think 70% of people is the estimate of who's been through some kind of trauma. And then less than that for developmental trauma and recurrent trauma. But still, there's a lot of trauma out there. And there's a lot of neurodiversity. So then they overlap. And as always, there's a potential for misunderstanding and hurt in both directions. So people dealing with trauma are, for good reason, often sensitive to misunderstanding or rejection or being, left out or forgotten. And then people with neurodiversity are often in the same position. And so then when you're trying to have a conversation about one or the other, I mean, my mind boggles about, wow, how do we even put them together? And I do not, one of many reasons I'm not on internet forums discussing is I just feel like I know I'd step in it immediately with somebody somewhere and be hurtful in a way that I wouldn't want to be. But individually, I feel a little more hopeful about, okay, you're seeing these things which suggest neurodivergence to you. You've been through trauma in the past. There are a lot of hurts going on right now. I don't know how to understand this or put this all together, but let's just think about it and talk about it together, right? How do you see these interacting? This bothers you. What part of that do you think could be neurodivergence and what part could be trauma related? Or maybe in some ways we're thinking it's both. And then individually, if I misunderstand in the psychiatrist chair, hopefully we have a relationship and the person can say, no, I don't get that at all. Or even that hurts my feelings. And I'll say, okay, all right, wait, step me back here. What did I miss? And we can sort it out together. Yeah.
I appreciate that. Can we slow that down?
Yes.
That is really vital that you're naming that, like, building this relationship. Hopefully you've built this foundation in the relationship that they can tell you when it's not landing for them, when that's not their experience. So that's really vital. I just wanted to highlight that.
Yeah. Thank you. Thank you. Yeah. And as you can tell, I remind myself, I get enthusiastic about ideas and get carried away. And then I remind myself with the people I see, okay, wait, everyone agrees we don't know everything in psychiatry or mental health. I know I don't know everything about you. I know I'm going to make missteps. So if we can work with that together, you can tell me, it's a together project with you in the lead. And what we tell, or what I often tell our new psychiatrists in training that they get tired of me saying is be dumb. And I mean that in a facetious way, but also like, this person comes in, I don't know anything about them. And even when they say things that are like, oh, I feel exactly the same way. I don't know that I feel exactly the same way. And so it's so basic to say, well, I'm not sure. How do we put this together? But everybody who experiences that in a therapeutic setting realizes the things that can open up are just profound. And so when you said earlier, I feel like something basic is shifting for me or something, maybe this is obvious. That's the glory of it to me, is that we kind of specialize in mental health and the obvious that's just so easy to forget about or overlook.
Mm-hmm.
When I'm feeling good, I call myself a master of the obvious. But to me, that's like, just settle down and listen to people and try to understand. Well, everybody knows that. You don't have to be a therapist to know that.
Mm-hmm.
But the daily, the hourly, the minute by minute practice of doing that, I think is profound. And then something beautiful happens, even if I don't know all the vocabulary or the techniques, or there's some new school. I've been doing this a long time. There's another new school of thought or therapy or change, and I'm behind the times, and I'll catch up as best I can, but I'm not going to know everything. All I've got is hopefully a grain of humility and a desire to connect and be in relationship. And wouldn't you know, that seems to be most of it.
That's the gold right there.
Yeah.
Well, that's exactly why we wanted to have you on this podcast. The way that you're holding this, the curiosity, the humility is so aligned with the NAR model. And I know our community is just really going to appreciate the things that you're sharing here. To kind of go back just a little bit, this idea of like we as humans, or at least a lot of us humans, are not like wired to be sitting in desks for 9 hours a day. And we put this kind of expectation on young children, as young as 5 years old, to be sitting at a desk for 6, however many hours a day. And I've spoken to lots of folks, and I would say my experience was that was there was kind of a developmental trauma just in that, maybe like an educational trauma. And that really hits deep for a lot of us that I felt as a young girl. I know there's a lot of folks that felt dumb or stupid in school because they couldn't sit for that many hours a day.
Yes.
And there's a trauma that comes with that. And so especially folks that would identify as on that spectrum, there's kind of an educational trauma that is linked. It can go hand in hand. And so again, when folks are coming in and they're saying, I would identify as neurodivergent, and I'm curious about this trauma piece and how those might kind of go hand in hand.
Yes, I think you said it beautifully. And I feel personally that while we try very hard as a culture to stay out of this sense of there's one right way or one size fits all, or this is the answer and this is how we do it, human history up to today and this hour is us as groups falling into this trap of there's the right way to do it. And before, they didn't know how to do it, but we have figured out how to do it. And this is how we're going to do it. And if this isn't working for you, something's wrong with you and you're not doing it right.
Mm-hmm.
And that's not as visceral as what you said, but I can't but agree. It's acute when people realize that it's not my choices. It's not some technique that I need to do differently. This is literally how I'm wired. And as a psychiatrist and somebody who's interested in brain science, that is so true more often than not, right? If we could, quote, do better, we would, quote, do better. And again, I'm the same way. If I could be good at doing taxes, I would be good at doing taxes, and I'm not. And then as kids, we don't have that apparatus or that defense. All we have is people saying, I know you're bright, you could do so much better. Or if you would just apply yourself, or, I'm very disappointed, or just, I don't know if this still happens, but when I was growing up, the papers would get graded and passed out, and we'd all be sitting at our desk, and you could see a lot of other people's grades, and we're all curious, and we're all seeing other people's grades. And you're a kid and you're doing the best you can. And what you get back is all this that used to be, your paper would be marked up with red and it would be like a D or an F. What you tried to do and what your experience was when you're filling out that form or taking the test, it's the same for somebody who gets 100 or somebody who gets an F, which is you're just a kid sitting there, trying to do what they tell you. And then you try 1,000 times and they say, we're so disappointed. And what's wrong with you?
Right.
And this has been very well articulated by people on the autism spectrum. My experience is more professionally with attention deficit. Every person that I've seen that we agreed, okay, attention deficit applies here, has deep scars and low self-esteem and this deep feeling of, I'm going to mess it up. I'm not good enough. Something's wrong with me. Why don't I try harder? Why can't I do this? And it typically takes a lot of not only understanding, but therapy and emotional work to get past that, or at least to get outside of that and what those voices tend to say. So I think your point is very well taken about being different is a setup for being wounded, if not traumatized. And then I both want to say we can do better as a culture, but I also want to say sometimes when we think we're perfecting our culture, we're actually wounding a different set of people. We're just changing the set of people that get wounded. And so that's part of my personal caution about let's adapt and change, but let's look as we do that and say, who are we leaving out? Who are we not understanding here?
Yeah, I'm just sitting with that a little bit. Again, feeling a little bit of internal reorganization. It's a tender thing for me. I have 3 children. All 3 of them have inherited maybe, or they've been modeled, some of my traits. And so navigating the educational system for them, especially my littlest guy, he is out there climbing trees, just like I was, and is not wired to be sitting in a desk for 6 hours. So navigating that, finding a supportive environment for him. And also I'm holding this idea, I recently heard, I think Brad shared it, this idea of prepare the child for the road, not the road for the child. So I'm holding that of they're going to need to be able to function in society. What sort of skills and development do they need? And do I want to just completely pull them out of this? So there's a lot we as humans are holding around all of these issues.
So well said.
Yeah.
Being a parent is so impossible. I have grown children. It was an embarrassment to me that I was a psychiatrist and I couldn't, quote, do better as a parent. Including that vexing question of, I'll do anything to save them from the kinds of emotional wounds and pain that I know are out there. And then at the same time, if I protect them from all of it, how much are they going to be able to learn and adapt?
Yeah. Dan, I really appreciate you taking the time, and I just really am appreciating your heart and how you're holding your work, and feeling really into the appreciation of that there's folks like you out in the world doing this kind of work. So thank you.
Thank you. I feel the same way. This is a great conversation to me. So I appreciate being a part of it.
Yeah. Can you share with listeners how can they find you? I mean, they can Google your name and there's lots of good stuff that comes up. But, what would you recommend in terms of folks if they're wanting to track down your work?
I have a book called Science Over Stigma, and it is more expensive than I wish it were. So if you want a half-price copy, you can email me and we can make arrangements for you to get that. But also, of course, everything is online. So I have a series of columns that are mostly in Psychiatric Times, which is just a psychiatry kind of magazine. And those are the two main places I have my writing out.
Fantastic. Well, thank you again. We so appreciate you. And I look forward to tracking more of your work.
My pleasure. Thank you.
Thanks so much for joining us for today's episode. To find more information about our guest, check the show notes or visit us at complextraumatrainingcenter.com/transforming trauma. You can also connect with us in other ways. We're on Instagram, Facebook, and YouTube. As a mental health professional, your commitment to healing and growth inspires us. We at the Complex Trauma Training Center are committed to supporting you in your well-being and success. That's why we're honored to invite you to our Space Program 2025, an interdevelopment program of support and self-discovery for therapists on the personal, interpersonal, and transpersonal levels. Running over 6 online sessions in 2025, this interactive experiential learning program is designed to support self-care and self-discovery for therapists, exploring internally, relationally, and transpersonally. CTTC faculty will welcome you into a professional community of therapists that are seeking to create greater effectiveness and resilience in our professional lives. As CTTC faculty Brad Kammer says, the intent is that this program will help us not only become more effective therapists, but also love our work more. Please visit complextraumatrainingcenter.com and secure your spot in the 2025 SPACE program. Thanks to Andrea Klunder and the Creative Imposter Studios for producing and editing, to Elisa Sponseller for our album art, and to Brad Kammer for the creation of this podcast. We look forward to building community and connection with you and changing the world by transforming trauma.